Welcome to ATO Unfiltered, where we talk about all things mental and behavioral health. We interview incredible individuals to dive deep into their stories of aspiring, thriving, and overcoming. Connect with us to discover emotional understanding and find resources to help you live the life you strive for. I'm Xotchil Rodriguez. I'm your host. Let's dive in. Hello and welcome to ATO Unfiltered. On this episode, we do have a special guest. She's a dear friend of mine, but also a colleague, and I highly admire and respect her work. She's also a therapist, a clinician like I am, so this is going to be a lot of mental health talking, but we're talking about something that she specializes on that I have very little knowledge about, which is neurofeedback. And it is my pleasure to introduce you to DawnPatrice Youngs, therapist and mother and so many other things. Good friend for me.
Yes. Yeah, we have many hats, right? Yes, different roles in our worlds. Yes, and we take them on, put them off. Which is a good thing. As I was talking to a dear friend of mine, that ability to be a chameleon, right? Yeah, that's a good thing. Yes, we took a rabbit hole into being fake, and no, it's not being fake. It's just wearing your different hats and whichever one feels good in the moment. So yes, many roles. And ironically, those roles led me into neurofeedback. So been a therapist for 20 plus years. I think we're almost over 25 years now.
She started when she was 2.
I am 50 and fearless. Thank you. Yeah, own it.
Oh, now.
I have earned it.
Oh, yes. So, yes.
But yeah, so before I was a counselor, I was a special education teacher.
Okay.
And I worked with predominantly my specialization as a special education teacher. You get all that out. Was working with learning disabilities, ADHD, emotional disabilities in the classroom.
Okay.
It's a different brain. And it becomes very evident very quickly that it's a different brain and you got to learn how to work with it, right? So that kind of rolled me into the brain, quantum learning. I don't know if you remember that as a teacher. Quantum learning totally was up my alley. How can we teach using what we know about the brain for the individual to receive as much information, right?
We'll be able to absorb it, yeah.
100%. And so fell in love with the brain, dabbled in it in college as well. I have a health degree and I loved that whole portion. Rolling that into being a therapist, again, you're working with clients. I have a tendency to work with high-performing, high-achieving individuals, lots of women, CEOs, entrepreneurs. I guess that's my weak clique. And they're they're highly intelligent, highly motivated. They get to a point where you've done all the cognitive restructuring. You've worked CBT backwards and forwards. They know it. They can recite it to you. They've changed behaviorally their whole structure at home. And yet there's still something, right? Something. And for the individuals that I work with, it's typically, we describe it as a hum. There's just a hum in there. And we want to calm that. So how can we calm that, right? So I started deep diving. It happened to coincide with some family stuff going on with my own children, with the ADHD piece, because that rolls into this. And how best can I assist them, right? Lots of these individuals don't want to do medication, or they've done medication in the past, but successfully. They want to be clean. They want to come off of them.
Well, if they're high performing, sometimes those medications can
not
affect, yes.
Right.
Yes,
There's always
performance.
They like to say that there's side effects to medications. They're not side effects. They're effects that we don't like.
Correct. Yes.
Right?
So we put it to the side.
Patient can do this, and this. We like this one. We don't like these ones. So we're going to call these side effects.
Yes.
When really they're not. They're effects, right? You're taking medication. You are altering your body. They don't like the others. Maybe it's weight gain, emotional numbing, gastro issues, constant nausea, whatever. They don't want it. They want something different. So this is what led me into neurofeedback, my own personal hum that I had. It's really not there now because I did the neurofeedback. So neurofeedback goes further. Instead of being kind of nebulous in this psychological world, right? It's all thinking stuff. Turning back in and saying, well, if we've done all this thinking and this behavioral stuff, we process traumatic events. Those are no longer bringing up high emotions, right? We've done all of this
And the work, yes.
psychological stuff. So let's turn inside. Is there a chance that the brain might not be working optimally? Right? They're causing these mental health symptoms. And it was these little aha moments. Well, yes.
Yes.
It can happen.
It can happen like that.
It can,
Especially if you're working with high achieving individuals. And I imagine I'm extremely driven. And so whenever I see my therapist and we go through to cognitive behavioral therapy or with any other therapy, I make sure that I make the change because I'm that driven. So these individuals that you see, and I'm just kind of filling the blank a little bit, they do the work. It's not like they don't do the work. It's not like they don't face their trauma. It's like anything that I can do to get rid of this pain, of this cycle, of this pattern or whatever. So
correct.
You've done all the work and now they're still
leveling up.
Yes.
Right?
Yes.
It's kind of in the same vein as the biohacking. What else can I do to level up and be better?
Yeah. Give me 1 second. I'm going to, can you cut this?
Yeah. That's what I was setting up to come.
Yeah. You're going to have to. Yeah, so I can, sorry.
Write down the timestamp.
Yes. I'm going to do not disturb and airplane mode so that we don't get, sorry. I forgot. I thought about it and then okay. So we're going to go right back in. Ready.
This is idea of biohacking and leveling up your whole system, right? And it's just brain health is really how I kind of look at it. So neurofeedback, what we do is we start off, and trust me, you should not be doing neurofeedback if you are not doing this process. Because there's lots of people. Do not try this at home. Do not borrow somebody else's system, and don't buy a system off the internet and think this is
So this is a system.
It is not.
Okay.
So there are a lot of products out there that say they're neurofeedback. But if you don't start off with a QEEG, which is a quantitative electroencephalogram, it's the electrical reading of your brain. If you're not starting off with that, it's not neurofeedback.
Okay.
Right? So we do our cues in office, which makes it convenient. And then we upload them. It's 11 minutes. It's 22 minutes total. 11 minutes with your eyes closed and 11 minutes with your eyes open, where it's the squiggly lines on a screen, if anybody has had that before. So all of these...
Like an EKG reading kind of thing?
Yes. And it's going to be 19 different electrodes. So you're going to see 19.
Are you connected to the machine?
You have like a polo cap.
Okay.
It's like a swim cap. And it has 19 electrodes in it.
Oh.
And there's conductive gel under each one of these electrodes. And we are reading. We're not sucking anything out of it.
You're sucking out your soul.
Right.
We're not doing that.
Right. This is not a brain sucker. We are reading the electrical activity underneath each one of these electrodes. That each one of the electrodes is giving you an EEG, an electroencephalogram, underneath that electrode. The quantitative component is where we put it all together.
Right.
Quantitatively, we're looking at it. So we upload this. We send it off to 3 different doctors, 2 neurologists, 1 PhD. and we're screening. So the first one goes through, first MD looks at it, and he's looking at each one of those individual electrode sites. And he's looking at the pattern underneath it to say, like, hey, is there something off here? Could there be a lesion? Could there be a tumor that's putting off an electrical pattern that we need to address first? Okay, because that could be leading to the reasons why you're feeling the way you're feeling. Oh wow, right? So we're being very prudent. We got to check one box, then we move to the next box. So we check off the EEG box, and then it moves over to another MD neurologist who is also an epileptologist, to say that slowly. Okay. And he's looking at the quantitative, the whole picture of all of these different signals. What kind of pattern do they make together? Because we know the brain, they've gotten they've done hundreds of thousands. The Russians have a big database. Japanese have a big database. Americans have a big database. They all talk to each other very nicely. It's awesome.
We're nice on this aspect. Yes.
We're very nice in this aspect. It's all about science. And they have figured out what normative database, what it should look like. So they know you have 5 different brain waves. We have delta, theta, alpha, beta, and gamma. And we know how much, and that's just a bandwidth of electricity that your brain is producing. We know where that should be, where alpha should be, where theta should be, delta, gamma, all of that kind of stuff. And in what kind of ratio? Yes, so we know the range, and we know the location, and we know what the ratios between them should be. So when we see something that is off, we see too much beta in the front. That's indicative of ADHD. That's indicative of anxiety. Okay. Just because it's indicative doesn't mean it is for you. All right. Okay. Case in point, my mentors have seen a spot right here that is indicative. We call it a depression marker. And so they always ask, do you experience any symptoms of depression? Yes. I go the opposite direction. Right. Yes. Pull me off the ceiling. Yes. But I don't go low. Right. Well, I've heard this for several years. Because I've got a brain malformation. Anyways, that I have to have checked every 5 years. It happened to coincide. I think I had it done a year ago. Excuse me. And when the neurologist was going over my MRI, he goes, everything looks fine. I don't see any concerns that we have. You do have some lesions right here. And I was like, wait, where are they? He gave me the markers and everything. And I was like, okay. And I said, how many? And he goes, there's about 3 tiny lesions. And then, well, guess what? Those lesions are going to produce a different electrical activity, which totally makes sense why they're coming up as a depression in that area. Yes. Right. But that's what my reality is, right? So
that's why you need different opinions.
Correct. Yes. Correct. And we're taking the objective data of the QEEG, and then we're having our clients fill out the subjective data, which is, it's a CNC, it's a standardized questionnaire. It's 300 questions. You answer questions on a Likert scale, 1 to 7. So 300 questions. That's a lot. Yeah, it's a lot. But they're Likert scale. So how much of this sounds like you? And then 1 through 7, you're gonna choose your answer.
Do you do every session?
No, just in the beginning when we do the Q. So then we have the Q, which is our scientific objective data. And then we have the CNC, which is your subjective personal experiences of your world. And then when we overlay them. Okay. And then that helps us to decide where we target our neurofeedback protocol. So for me, I may have a marker up here, but I don't have a marker subjectively. So we're going to leave that alone. Okay. Because my brain has figured out different ways to work with that where I'm not experiencing those symptoms.
The depression. Yes.
Correct. Yeah. Right. So it's very individualized. So this harkens all the way back to my original start in my career as a special education teacher with an individual education plan. Yeah. So we're just doing an individual neurofeedback protocol that's based on that same type thing. What is your brain telling us? What are you experiencing for us to target? So then when we go in and target those areas, We then do the neurofeedback protocols.
Okay.
For that, you come in, we do them in 20 packages of 20. So you're coming into my sessions. Yes, 20 sessions. You are coming in my office twice a week for 2.5 months, right? Roughly. I always tell people plan on 3 months, vacation, sickness, horrible weather, whatever, right? Phrases, snow. So 3 months of your life, you're investing, right? It's about an hour. You come in and you sit down in a comfy recliner. One day you need to come over and sit.
I know, yeah.
It's very yummy. These recliners, you're going to sit on it. You're going to have a laptop on a desk tray. You're going to get to watch whatever your favorite streaming platform is. We have Hulu, Netflix, and Prime. But if you want to log into your Apple or your Disney, whatever, we have kids. If they want to watch YouTube videos, whatever, it's fine, right? So you're going to be watching your favorite thing. We're going to have the electrodes connected, more than likely one or two, just one or two, which is reading your EEG in real time. And every time you make the brainwave that we want you to, that is going to make a new pathway and remove symptoms, you get full screen and full volume. So it's operant conditioning. You give us what we want, then we'll give your brain what it wants, right? It happens at milliseconds. You would think that, well, there was one day when I was working with my brother. He knows he's going to be here. It's going to be talked about. Good. So he knows. So we're all good. But we were overworking his brain. So the screen was black.
Oh, wow.
And he was like, sis, can't do this. This is making my head hurt. And I hadn't looked at the screen yet because I was messing with the computers behind, because I get to make it harder or easier on the backside. And he was like, yes, sis, no.
Yeah.
No. And I look over and I'm like, oh,
yes.
Yeah, that can't be pleasant. And he was like, it's not.
And I know he's your brother, but
yes, I know. He's my older brother. So yeah, turnabout's fair play. He was pretty rough with me. So,
Yeah, no, I know some of the history. So that's what I was like, I'm not surprised.
Yeah, right. So we made it a lot easier. And then he started seeing the picture and hearing the volume. And he was like, all right. So it's like this millisecond flicker, but not like an overhead fluorescent flicker or anything like that, right? That's not what we're promoting. But the more you do it, you create this new pathway
on your brain.
And your brain is making actually a new pathway, right? Wow. This neuroplasticity everybody talks about, that's what we're doing. We are making new neuronal pathways. When we do that, we teach your brain to work more efficiently, and then those mental health symptoms dissipate. It's like a dimmer switch. You're not turning out the lights to your brain fog or your impulsivity or anything like that. We're just dimming the switch.
Kind of redirecting. Is that right?
Yeah, correct. And that's what it feels like, right? So before I used my family as guinea pigs, I used myself as guinea pig first.
That's what we do, yeah.
Because my son was number one. And I don't think any mom's going to do something to their children if they haven't done it themselves.
What's Steven?
Right. Yes, this was Steven. This was my sweet Steven. And he knows too. So he's okay with just talking about it. But
I was his teacher.
Yes. And he adores her. So I was doing it at work, experimenting on myself. Didn't tell anybody what I was doing. About 6 weeks into it, my husband, Matt, on Mondays, I'm at home, typically 14 from home, and he's home and he travels a lot. So it's a way for us to stay together. And he's at one end of the table, and I'm at the on the other. And normally what would happen is around 9:30, 10 o'clock, the tightness, the hum would just start like somebody put the gas pedal down. I pull, revving it up. Like, I can't. And luckily I trained my system very well. And I would just start to raise my hand like this. like you're in school.
So would that be considered like anxiety?
Yes.
Yes. Okay.
Yes.
Okay.
Totally anxiety. I was getting overwhelmed with all the responsibility
Right.
of running your own practice and this kind of thing, all the things I want to do in my creative brain. Like, and so I would start to get overwhelmed and I would just slowly raise my hand and then he would see it and he'd get up and he'd walk around and he'd rub my back. So I'd take a breath. Take a breath. I've trained him very well.
Yes.
And then he would say, all right, so what's in your head? Spit it out. Let's put it on paper. Prioritize. What are the important things? What can wait? That type of thing. This has been going on for, I know, years, right? So about 6 weeks into this personal neurofeedback training of myself, he was like, hey, have you noticed that like your Mondays are a lot, like they're just smoother. They're a lot chill.
Yeah.
And I was like, oh. And I stopped and I started thinking, and he's so right. And then I
Sometimes it takes somebody else to tell you, especially us.
well, and that's what happened, right? That's what happens with neurofeedback, and it's what I tell parents all the time and adults that come in. I'm like, you are probably not going to recognize this first. It's going to be a family member because we're just that self-reflective.
Yeah.
And I mean, I'm a therapist for a really long time. Like I'm pretty aware, but we're not that aware.
We're not that.
Right?
Yes.
I mean,
Yeah.
we're
We're
just
with everybody else sometimes. Yes.
Exactly. I'm great with everybody else.
Yeah.
But yeah, it's hard to differentiate sometimes. So that's what I tell clients all the time. It's a dimmer switch. And somewhere typically between session 5 and 8, you're going to be going, oh, right. And these are the things I hear. I didn't yell at my kids when I really wanted to just rip them. Right. A lot of stay-at-home moms and just really wanted to rip their heads off. And I did it.
Yay.
Yay.
Yeah.
Right. I didn't go after my husband last night when he did something that was perceived stupid that would have set them off. Right. Had a small girl that had rage stuff going on. And talking to the sweet girl, so sweet and so self-aware, young 5-6-year-old,
Very young. Yeah.
very aware, and eyes would just puddle up with tears saying, I don't know, I can't stop.
And they don't want to be like that.
And they don't want to be
like what we're children.
so pure, right? And it just makes your little heart just, and then working with them and seeing the family dynamics shift. She's not raging for 4 to 6 hours.
Oh, yeah, intense.
Yeah. Like I said, most of the time neurofeedback is not the first course. I wish it was, but this is, gone through OT, PT, ABA, right? All of these different things before they find their way
into here. Yes. It's still pretty kind of new, right? Am I maybe not? Maybe just
not
from my
new.
Yeah.
Here's the thing. There's, I could quote wrong, but I want to say 40, 60 years of data. Like,
Okay.
I mean,
Yeah.
There's lots of data out there. The problem is that because it's not accepted, it's still considered experimental, which means insurance companies haven't accepted it.
Yes.
That's what that means.
Oh, okay.
Right.
Yes.
I mean, if it's experimental, it means that insurance companies haven't accepted it. And unfortunately, insurance companies drive Western medicine.
Exactly.
Right?
Yes.
And so that's why. That's why. When there's something wrong with us, we go to the doctor. And so the doctor, if it's not insurance, they're not going to.
You're going to go the route. Yeah. The insurance goes.
Correct.
So while they're doing, let's say they do 8 sessions or they do the, you said 2 months, right?
20 sessions.
20 sessions. And they come twice a week. During that time, are they also having talk therapy? Like,
it is. Okay. Yes and no.
okay.
There are plenty of people who have already done all the talk therapy and they're like, I'm like, I've already made all the changes.
Yes.
Like, I don't need that.
Yeah.
This is my level up. Right. So no for them. Yes, for some others that are in the thick, right? They're lost. Lots of times they're on medication. Medication is not working. They are way overly stimulated. They need,
It's part of that.
yeah, it's a transition.
They
right?
know the tools.
Correct.
Okay.
But as what we see is the more we do the neurofeedback, the more they're able to pull back from their regular therapist. Or they're able to then really lean into their regular therapist.
Yes.
Right?
Yeah.
Because we've calmed down the system to where they can
Really open up.
what the therapist is trying to help them with.
Yes.
Right? This cognitive behavioral is the behavioral.
So this does not replace therapy at all. This is a complement of therapy.
It's totally
Yes.
Yes. So I have my Young's counseling traditional talk therapy practice, but then I have the separate, and that's why it's separate.
Okay.
Neurofeedback of Cypress, so that individuals who don't want therapy can just do the neurofeedback. I have clients that do both in our practice. I have neurofeedback clients who are seeing therapists outside.
Yes.
Right. And no one has to use us as their therapist to use neurofeedback.
Okay.
I'm honestly, I'd rather partner with other therapists in the area.
Right. Yeah.
Just to move people farther. Right.
Yeah. And we're here for the community. We're here for the clients. We're here for the collective. So
Correct.
I was going to ask, so is there any ideal client for neurofeedback or any ideal diagnosis, or is it like, who does it work for better?
What I see, and the highest efficacy level will be level 5. What we see, level 5 for ADHD. In actuality, my understanding is the state of Texas passed a bill 2 years ago, I think, that if a person had, specifically a child, had a diagnosis of ADHD, traumatic brain injury, and that included alcohol abuse. Those 3 things, they could get neurofeedback reimbursed through their provider. I don't know the ins and outs of that. Honestly, I don't have the brain capacity to take on that endeavor yet, but we do create the super bills so that people can ask for their reimbursement. Yes, on the backside, they can go in and do that. And we've had some people that have had good luck with getting all of it reimbursed. We've had really good luck. Pretty much all our clients that do it are at least able to get it to go towards their deductible.
Or FSA cards and things like that.
FSA cards, health savings cards. Also, both of those. So we do use the appropriate CPTs. But yeah.
Wow. So that is any age, like you say, you treat young kids too with it.
Yes. So yes, to finish that whole thought process, ADHD is efficacy level. It's always a hard word. Efficacy level of 5. Anxiety has an efficacy level of 5 as well.
Okay.
So that I would say are the majority of our clients are ADHD of some form or behavior concerns. You don't have to have a diagnosis of those things
to be able to reach out
neurofeedback.
Gotcha.
Right?
Yes.
I have a lot of parents who don't want labels, which I totally respect. So they come in as behavioral concerns. And usually the comment that I hear is, the pediatrician is saying that like maybe in a couple of years, we might be looking at an ADHD dose. I'm diagnosed, and I really want to stay away from that. I'm like, that's great.
Because especially doctors, they jump right into medication, and a lot of us are,
and there's a lot of people that want to go away from that. And in all honesty, I have 3 ADHD children because we have 2 ADHD parents. Funny how that works.
Yes.
We did the medication with our oldest, Stephen, and he will tell you it sucked and he wished it never happened. But that's what I knew as a special education teacher, right? But now I've read the longitude studies. Now we have enough years to be able to have the longitudinal studies to say this, the stimulants are not good, that we're doing damage, right? The SSRIs were doing damage or impairing the body's own ability to, to make serotonin, et cetera. Benzodiazepines, oh my gosh, it's used for anxiety all the time. Clonazepam, Ativan, Xanax, those types of things. Major damage to the brain. What are they doing?
Right.
What are we doing? If we can do neurofeedback and fix the brain waves, right? Help the brain in areas that it's struggling. Yes. I mean, I've had, 50-year-old men come off their ADHD medication. It takes a little longer. You're looking at about 50 to 60 sessions. Yeah. But with the kids, that's why I love working with the kids. Bring them in 20 sessions. Oh my gosh, they're different people. Yeah. I watch them walk in my office. My office is kind of like, I say, it's like a tornado that comes in. I don't mean that in a negative way. But the chairs are all moved around in the lobby. We have stress balls. They're all over the place. Yeah. Like magazines are everywhere. And I'm like, oh, we had a youngin' in here today. Right. But then at the end of their 20 sessions, they walk very politely. They sit up in their chair. They scooch back. They wait. Can we start? Whereas before, they're like banging on the laptop and like moving cords. And
so regulating emotion. When I might need to come and see.
I'm telling you, it was life-changing for me to the point, like I said, it was me, then it was Steven, then it was my husband, then it was my brother, or then it was my daughter, then it was my brother, and it was my mom. We brought the whole family in.
And if you believe in something, that's what you do.
Right.
That's what you do.
And then I opened it up to long-term clients that knew what I was doing all along, and they were waiting. They were chomping at the bit. When can I? And then I started rolling them through. And when you want these clients sitting across from you, crying, saying, I feel normal for the first time in my life. And it makes me, right? I mean, that's so, that's just you guys from moving. It's very empowering for them. You're not broken.
Right.
You just needed to help your brain.
Yeah. We just needed to shuffle something up. Yeah.
We just needed to make some new pathways in there.
Yeah.
Was using
new roads.
I always laugh and I say, it's like, okay, we got Google. So I'm a native Houstonian. And I used to have to drive from living out in the Cypress area. I used to have to drive my dad every other weekend to Hobby. Right. So you go, it's a long way. It's a long way. So I went 290. What is it? 290, I-10, 45, 290, 610. I always get the blur right there. 290, 610, 45. I mean, it was this is what you do.
That's the route.
That's the route, right? And so think my brain has been doing this route this whole time. Well, guess what? It's not very efficient. I've got some issues. Maybe, I don't know. That's where the anxiety came from. We got to do something different. But then all of a sudden there's construction. Right?
So much fun.
And Google says reroute, and it takes you this whole other way. And you're like, oh my gosh, what are we doing? What are we doing? Am I going to get lost? I don't know where I am. I don't know where I am.
Right. And now we're GPS.
And that's what I'm saying. And so then you go, oh my gosh, this is so much faster than my 290, my 610, 45. I'm like, no, haven't I been doing this?
Yes.
Right? And it's so much better. And there's less traffic and it's so much easier. I mean, like, that's what we're doing. We're rerouting the brain. Reroute.
Yes. That's it's such an interesting, because I've had those clients where they have, high anxiety and talk therapy takes them to a different, like, it brings them down to a level. Doesn't mean that they're not suffering, they're still not suffering from anxiety. They still have it. It's just they're being able to cope with some of it.
They're responding to it.
They're responding to it better, but the feeling and the emotion is still
correct.
So it's so good to know.
Because of all of this, and I'm very much a nerd in a good way, that's what led me back into grad school. And then in grad school, you're learning about all of these clinical diagnoses, which I hate diagnoses. I don't like the DSM. Yes, I said it.
Same.
Yeah. because it just like makes us a label and it doesn't talk about why and how and like what if there's something wrong with my brain, what if there's a genetic piece to it, right? And so you start learning, and they have found that people with ADHD and anxiety literally have an issue deep down in their brain. It basically, doesn't work right.
Yes.
And and then that's just like this whole like I'm not looking. Yeah.
Is that why your PhD? That I know you're going for your PhD.
Yes, that's where your PhD.
I know we talked a little bit about it before, but
It's applied psychophysiology. Okay. It's where your mental health and your body coincide.
yes,
Right. Just like you were talking about with the anxiety. We can do talk therapy and work through a lot of stuff, but we need to start teaching them to pay attention to their physiological responses. Like you don't just have a panic attack.
Yeah.
You don't. It rolls up on you. Your body is telling you something. Maybe you had headaches earlier in the week. Do you know what I'm saying?
Yes.
Your body is always
Communicating to us. Yeah. Always.
We have to learn to understand and interpret what it's saying.
Yeah. Yeah. Excellent stuff. Well, just to kind of close it up, where can people find you? As you know, for Neurofeedback from Cyprus, that's the practice name. And can you tell? Well, you're in Cyprus, obviously.
We're on Cyprus.
Website or anything?
Website is NFB of Cyprus.com. We are located, it's the spaghetti bowl of Valletta and Huffmeister.
Okay. Yeah.
The address is off Huffmeister in Cypress, Texas, but it's right where it splits and then turns like into.
Yeah, I know what you're talking about.
Pretty quick.
Okay. Okay. Well, thank you very much for being here. It was such a pleasure to learn so much. Like I said, I see this woman, I admire this woman. I didn't know anything about neurofeedback now. Like I said, I might come to your office. I need some help. I think everybody that knows me can agree. But thank you so much for listening to you guys. We're going to put her information, her website, and things like that in the comments of this episode, so you can get in touch if you're interested in your feedback and learning more about it, or just kind of exploring and, just call the office and ask questions to see if it's something that you're interested in. But thank you so much for being here. Thank you for listening, and we'll see you in the next episode.